Osteoarthritis is the most common form of arthritis. About 1 in 10 Canadians living with it. It causes pain and swelling in certain joints. And our health specialist Leah Sarich now with how research is underway at the University of Calgary, hoping to help people with osteoarthritis of the knee. Very common.
Yeah, extremely common. And it's going to be worse as our population ages, of course. As those boomers get into their 70s, we got lots of knee problems on the horizon. So OA is a progressive disease, osteoarthritis, a progressive disease with no cure, and there's no way to reverse the damage that's already been done. But right now, those with OA in the knee are all given the same sort of insole in hopes of helping people feel less pain. However, for some it helps, and for some it doesn't. So it's this idea of personalized medicine where we're hearing a lot lately. In fact, I was just talking about this on Tuesday with kidney disease, the idea of personalized medicine. So what we want to look at, though, in this case, is whether or not those insoles are in fact what they call biomechanically relevant. So does it actually work with the way that person moves? And if it does work for them, is that actually going to help them more?
We have one testing session. It's about 1.5 to 2 hours long. Patients would come in and they'd walk along a runway approximately 5 times with a couple of different footwear conditions. We compare all of our custom insoles versus what they normally experience, so we can see are our insoles actually having a beneficial biomechanical effect relative to what they normally experience. If we find that we do have an insole that seems to be beneficial and from a biomechanical perspective, that's the insole that they get, and they get to take it home either on that day or in 3 months, depending on which group they're randomized to.
So here's an example of what they're going to do. So you get the insole in the shoe, and then you walk down this sort of runway. And he's actually got sensors attached to his leg, his knee, his foot, and he's stepping on a little metal plate there. And that metal plate actually measures the force being put on the ground. And you can see here, so you can see the movement there. That's actually the person who is walking down that little runway. So they're looking at whether that insole is actually working specifically for that participant, because everybody moves a little differently, everybody has a different body, and everybody has a little bit of a different disease. So the doctor on the study says it's all about helping people to basically before that OA gets really bad.
What we're trying to do with this is allow people to be more comfortable, particularly in the more early stages of the disease, where people are affected but aren't affected so badly that it's ruining their lives yet, and they can't do anything. So this study is hopefully going to help in one way to help control their pain, which allow them to be more active. Doesn't mean that they'll necessarily be able to run or do things like that, but hike and walk and cycle, all those things.
That's pretty good. They'll even take a 3D image of each individual's foot. You can see that happening right here. They take a little picture of it, and then they create a 3D model, which is right there. Isn't that neat?
Interesting.
I think that's cool. So they collect all of this data, and the participants get an orthotic to take home, which is great. So you actually get one to take home that's going to work for them. So of course, they're trying to determine if a patient gets an orthotic that they can show actually works for them, will that have an impact on their osteoarthritis? That's what they're trying to determine. So if you have a diagnosis of osteoarthritis, they're actually looking for study participants still to participate in this study. They're looking for about 25 people or so. So if you actually have a diagnosis, then do get in touch with them. They'd love to see you. You can email them at oastudy@ucalgary.ca, and of course all that information is going to be on my blog,
which is on breakfasttelevision.ca.
breakfasttelevision.ca. There you go.
Okay, great. Thanks, Leah. A
You're
lot of
welcome.
people suffering might benefit from that.